Today, I wanted to take a minute to talk about functionality of the pelvic floor. So here at Adventure, we spend a lot of time talking about bladder leakage and different forms of incontinence. And we talk a lot about what we need to work on in our pelvic floor. So we talk about strengthening, we talk about coordination, we talk about endurance. And what I find is really difficult for a lot of my patients is they may be getting stronger or more coordinated when they're working on their pelvic floor, so when they're sitting down or laying on their backs. But then how do you translate that into a functional activity? And that's what I find is often the hardest part for patients. And so just like every other muscle in the body, we need to train the pelvic floor to meet the demands that are placed on it. And so this is going to look different for everybody. It depends when your leakage is happening. So if you're someone who experiences leakage with coughing and sneezing only, that's going to look different than my patients who maybe they're distance runners, and that's when they start to experience their leakages at kilometer 12, or my weightlifters, or my moms who are doing the Mommy and Me classes. So it's going to depend on you individually, but today I really wanted to address how we use our pelvic floor functionally in common exercises in the gym, and in kind of more of a gym and activity setting. So in general, the pelvic floor needs to be strong enough and coordinated enough to resist the force that's coming down through the abdomen. And so when we're talking about things like exercises in particular, we want to be able to recruit our pelvic floor muscles to support us at the height of the movement. So the point of the movement that is the most difficult and the most strenuous, that's when we need the pelvic floor to come on and really support the bladder and the rest of the pelvic organs. So we're going to go into the gym and I'm going to show you a few examples, but something to keep in mind before we do that is we're talking about the hardest part of the movement typically. And so this isn't just squats and deadlifts, but it's also any upper body activities. Pretty much any exercise can be turned into a pelvic floor exercise if you're able to break the movement down and recognize the height of that movement. So let's go check it out. First up, we have squats. So on our way down, we're thinking inhale and then exhale, squeeze pelvic floor on the way up. Again, inhale on the way down and then squeeze on the way up. And then with deadlift, same idea, we're squeezing our pelvic floor on the way up. So inhale on the way down, squeeze and exhale on the way up. And then lastly, we threw in some bicep curls. Again, we're inhaling on the way down and then squeezing and exhaling on the way up. Relax, squeeze and lift with the exertion. So of course, these are just some examples of movements and exercises that I find I go over with patients quite often clinically. But any movement or any exercise that you experience leakage with can be broken down to better understand where the pelvic floor is not meeting the demands that are being placed on it. So the most effective way to understand what your pelvic floor needs to do better is to come in for an assessment or an appointment with a pelvic floor physiotherapist, and we can help to assess your movement patterns and figure out what exactly your pelvic floor needs in order to reduce your leakage.